Hello, everyone. Thank you for joining us today. We'll be starting our presentation in just a few moments. We do have a few people still logging in right now, so we'll give them a moment to do so. We'll start our presentation at 12:03. At this point, you should be able to see our screen with our first presentation slide stating that we'll be covering our online certificate in global health practice. If you have any issues seeing the presentation start, please let us know by typing into the Q&A box. Thank you, and we look forward to talking with you soon. Hello, everyone. Thank you for your attendance today. My name is Ameri Arias. I am an admissions officer here for the online programs of applied learning at Johns Hopkins University Bloomberg School of Public Health. Today, we'll be discussing our online graduate certificate in global health practice. Joining us today is Dr. Bill Brieger, Director of our Global Health Programs, and myself. My name is Ameri Arias. I'm an admissions officer for the online programs of applied learning. I work with our team here to assist students as they are exploring their options for continuing education. I'm excited to be presenting with you. Dr. Brieger, could you please introduce yourself?
Hi, yeah, I'm Bill Brieger. I'm in the Department of International Health, working with our health systems program and our social and behavioral interventions program. And most of my global experience was actually the 26 years I worked at the University of Ibadan in Nigeria.
Perfect. Thank you, Dr. Brieger, for your introduction. To give everyone an idea of what we will be covering today, Dr. Brieger will take us over the industry overview, discuss why there was a need for this program and give you an idea of where individuals who are coming into this program can look to apply those skills and knowledge they will be gaining. He will also go over program details and curriculum, give you an insight on the faculty and their backgrounds, who are active practitioners in the field, and to give you an idea of who you will be learning from and what their specific focuses have been in their academic and professional careers. Our program is fully online, so Dr. Brieger will give you an insight as to what it looks like to be in online learning here at Johns Hopkins University. I will go into admissions requirements, tuition and financial aid. We'll discuss the scholarship we offer. And at the end, we will save time for a Q&A. So please feel free as you're listening to the presentation. If you have any questions, please type them into the Q&A box. We will get those covered at the end with Dr. Brieger. Thank you so much for your time. And Dr. Brieger, please feel free to start.
Okay, thank you all for joining us. And what we, of course, want to make clear is that there's really no difference between international health and global health. We use the terms interchangeably. Our department is a Department of International Health, and it's been around. It's the oldest department devoted to that in a school of public health in the country. So we've been doing this work for 50 years. We're concerned about international or global context, looking at things like systems, looking at things like health status, health disease, burden of diseases across countries, comparing countries, looking at standards. So all of this, of course, is the context. So really the terms are interchangeable. And again, part of what we base our work on is the 1978 Alma Ata Declaration, which called for health for all, looking for universal approaches that promote equity, that promote access, that promote appropriate services to reach everyone, appropriate for wherever they happen to live. And so this again is where we get into the comparison of different systems and recognize that there are variations within countries as well as among and between countries. And so we want to look at that. We recognize that the issue of people requiring, needing, having better access to quality care is not something confined to low and middle income countries, but we have areas in all countries that are in need of better services. So we can go to the next. Okay, as I said, our department is the oldest in the country. We started in 1961, and coming up on an important anniversary. But again, we're looking at health problems and affordable, appropriate means of disease reduction for underserved populations throughout the world. And there's some links to our department. If you haven't already, we encourage you to look at that. And we are involved in research. We're involved in education, which of course you all are expressing an interest in. We are involved in education both in a formal sense with degrees and certificates and diplomas, but we also have projects that involve in-service training, on the ground types of learning situations. So we are involved in developing health policy based on research, based on evidence, and of course, directly involved in public health practice and capacity building of both public and NGO types of health institutions around the world. Okay. So again, we have two main audiences for our certificate, and I should mention that we first started a certificate around 10 years ago. That was before the advent of the OPAL program. And the idea was at that time, and it remains, to reach early and mid-career people who are looking to strengthen their knowledge and skills in terms of global health programming with the issues that we've just discussed. We did transition the certificate that was offered. It was completely online, as this one is offered just by the department alone, to the OPAL program, which had a better financial arrangement for students than previously. We do still offer a certificate for students who are enrolled in the various schools in the Johns Hopkins system, but that's again something that you all would not need to worry about, because what you would be doing is applying directly to the OPAL program. But we also want to gear our program, try to recruit people who have experience, maybe working for an NGO, maybe working for a health ministry, in a global setting, in a low middle income country, in an underserved area, and want to actually expand their experience to gain certain credentials that the certificate offers. And again, to say that the requirement that you have 2 years experience after a bachelor's degree does recognize the fact that we are looking for people who have some career experience. Our programs in global health reach people from various agencies, people who are working in development agencies such as USAID and DFID, the bilaterals such as WHO and UNICEF, the multilateral agencies, NGOs and health ministries in various countries around the world. And this is the type of focus that we are hoping that you would have. And in addition, as we said, some people may be wanting to make a strengthen their credentials to move into an international area. Some may already be working in an international agency and would benefit from having a credential that would help them with their future in the existing organization. Okay. Our department is involved in many things. We have 4 different programs. Our department is as big as some schools of public health in the country. We have 4 programs: the global disease control and epidemiology. We have health systems. We have social and behavioral interventions. And we also have many different centers that involve people from across these different programs in the department. We have a very active Center for American Indian Health that has field projects throughout the country. We have a center that focuses on human nutrition. Some of you are definitely interested in the humanitarian health issues, and we offer that. We have people doing research and service in maternal and newborn health. We have a very active vaccine center, but we look at vaccine from the safety point of view as well as the access point of view. So there's a lot of different activities going on within the department that are relevant for for international health, generating research, generating evidence. And again, as we said, using that for improving guidance and policies. Okay. We have an active research portfolio, and the grants obviously come and go, but as you can see, there are close in the past couple years, close to 200 active grants awarded to staff and faculty in the department per year. And you can see that these can be found all over the world, hence the international or global nature. And these are funded from places ranging from government agencies to foundations to international agencies. Okay. The idea, of course, is that the faculty working in these different research projects, in these different centers, in these different programs are people that you'll be in touch with. And therefore, we hope that with this kind of connection that you have, that you'll be equipped with the necessary skills to develop sustainable solutions. As you notice, the title includes the word practice. So we're very much concerned about people applying what they've learned in their work setting, their current work setting or their future work setting. And so the certificate as it stands now is 25 term credits. It can be completed in 1 academic year. Again, we're practice or skills-based oriented. 100% online. I think this is important to mention, and we involve you in group learning, peer assessment, skills activities, problem-solving activities. Our, this, we'll probably see this in an upcoming slide too, but want to stress that our school has a very professional Center for Teaching and Learning that has pioneered online education. We have our own platform that we've developed. I first started teaching my courses online in, I think it was 1996. And the Center for Teaching and Learning, and it's had several names, but our staff and our Center for helping develop technology for online learning started at least, I think, in 1995. And so now we have somewhere in the neighborhood of 150 or 200 courses that are offered online for the various programs and students we have. The courses for your certificate are specific, follow a specific curriculum. So there are not really options, but it's important to know that the school has a long experience in offering online education. Okay. So we can hopefully see here the courses that we offer. There are some things that one must take that are not for credit, but are necessary before you actually embark on the program. And one is Introduction to Online Learning, which is not mentioned here, but everybody needs to take that. And you can take that any time. Generally, people, once they receive their admissions letter, do sign up for the next iteration of that course. It runs about once a month. And that basically helps people understand how our online learning process works. So that would be an important first step, and I think you'll get a notice for that if you do apply. Also, all students associated with the School of Public Health must take a not-for-credit academic and research ethics course. So we have it lined up such that if you take 2 courses per term, you can finish the 25 credits in 1 year. We do say year 1 because there are people who, because of work or family responsibilities, cannot take 2 courses per term. And so they spread the program out over 2 years. You have a maximum of 3 years to finish the program. The introductory course for our global health practice, called Fundamentals of Global Health, is offered in that first term. And there is a public health seminar that students from a variety of the different OPAL programs take, and you have a chance to interact with them on current issues in public health. We have in the past offered our own ethics and global health course. That will probably not be available in the future because of changes in faculty. And so we are in the process of looking at alternatives, but you will be able to take the design and planning of primary healthcare projects. And this idea of project development for disadvantaged, underserved population is a very important skill. The overall OPAL program offers an introduction to epidemiology, and we also have our own global epidemiology course in 3rd term. Finally, we have a statistics course that is offered overall for OPAL students, and then a course in social and cultural factors in terms of healthcare. And so the interesting thing is that from our original certificate that started 10 years ago before OPAL, the fundamentals course, the global epidemiology course, and the social and cultural basis course were core requirements for that certificate. So we are still maintaining the heart of our original program. Okay. This is a recent gathering pre-COVID of faculty members. I think maybe about half the people happen to be in the country and in the building on that particular day. If everyone were around, like you can see, there's close to 200 people involved in the department. They probably all wouldn't have fit in that space. But we do have a variety of different types of people. We have the traditional professors who are involved in teaching, research, and service. We have our scientist track where people are focusing primarily on research with the help of research associates. And then we reach out into communities, into agencies that we collaborate with in different countries, and have associate adjunct appointments. And that's over 300 of those. Overall, the support staff that help keep everything running are over 200 people. And so in other words, it's like I said, one of the biggest department in the school and bigger than some schools of public health. Okay. These are some of the people involved in our programs. Dr. Baki is specialized in neonatal health and urban health. Rosemary Morgan, very much involved in health systems. Mariah Merritt is on a sabbatical now with NIH, but she is our expert in ethics. Henry Perry with primary health care, as well as Ambrasti Edward, primary health care and the role of NGOs. Maria Eng is a pharmacist by training and did her doctorate with us. So we have quite a number of people who are involved in this. Alain Lebrique is involved in our global epidemiology course, but is an expert in what we call mHealth, mobile health systems. So we have quite a number of people. Dr. Burnham is somebody who I had known for years before I even came to Hopkins to work. He has been very active in tropical disease control, and so was I. So that's how we met. So we have people with reputations, with experience, who are involved in our various programs. And Christina Salazar is the person within the department who helps us get ourselves and everything organized with the curriculum, helps shepherd all of those things through. But of course, we do have our own OPAL support staff, and I'm not sure if we could mention that if it's not in a slide, but we do have a very active group of people who are dedicated to working with students in our OPAL programs. So as I said before, the online learning office program in the school has been running for almost 25 years. We have a very strong production center with staff to help develop, faculty develop their lectures, to help produce the lectures, to help ensure that things actually function online, to run the online system, because as I said, we are not using anyone else's platform, we've developed our own. So we have a combination of faculty recorded lectures in advance. So this gives you the opportunity to listen whenever you're free. You can even download them and take them in your car, or put them, your earbuds in and listen to them while you're on the train commuting, that type of thing. We do have some live talks, usually depending on the course, anywhere from 2 to 5 live sessions, and where the course instructors and sometimes guest speakers come, and there's an opportunity to interact and ask questions. The good thing about the online learning is that there is a 24/7 technical help desk, because there's always a situation where you can't access this, the particular browser you're using may have a problem, and so there's always somebody to help you get through that. Okay. We have a variety of assessment methods in our courses. We have self-grading quizzes, but we don't rely on that 100%, because we like to have interaction and learning, students learning from each other. So we have discussion forums where issues and questions are posed, people give their opinion, search for information and share that, and then people interact and comment on what each other have presented. We have step-by-step worksheets that help you define and analyze a problem. As we said, there's also the live talks where you can participate, short essays, and other kinds of problem-solving exercises and case studies. We do, of course, encourage students to share their experiences in these various ways so that we can learn from each other. Okay. So as we said, the technical help desk is available. Very easy to access. They usually respond to an email within 30 minutes. We also have academic support. If you are in a particular course, the faculty and their teaching assistants do respond quite quickly to any questions you have, whether it's your assignments, whether you need an extended period of time to submit the work. And there are a number of student services available to anybody who is enrolled in a School of Public Health, Johns Hopkins School of Public Health program. Student services, there are mental health services, there are career services. There are quite a number of things that you can access because you are, will be a student of Johns Hopkins. Okay.
Okay. Thank you, Dr. Brieger, for all the insight into our program. We do have a couple of questions coming in. We will hold those for the end for Dr. Brieger to cover. So if you have any questions, please feel free to put them into the Q&A box. I am going to take some time to go over the admissions requirements. If you are interested in moving forward, it is important what you need to know about the admissions process. All of our applications are processed online through Sophus Express. To streamline your application process, the requirement for education is a minimum of a bachelor's degree from a regionally accredited college or university. The professional requirement is a minimum of 2 years of health-related experience, post-bachelor's degree focusing primarily on low and middle income countries or underserved populations. Dr. Brieger gave some examples of that earlier in our presentation. Students who have come into the program previously. We do require a current resume or CV to be uploaded into the online portal, one letter of recommendation, the statement of purpose, which is your biggest piece of your file, as to, communicating to the committee, admissions committee, why this program, how this program matches up to your career goals and what educational objectives you're trying to fulfill and what you're hoping to obtain out of this program and how you hope to apply it in your career and in your future. For our international students, if English is not your first language, you may need an English proficiency exam. We accept either the TOEFL or the IELTS. For those who have obtained education outside of the US for your academic records, it is a requirement that you undergo a course-by-course credential evaluation via the World Education Services. And as you can see on this, we have shortened it out on our slide here as WES, WES, which stands for World Education Services. I do encourage you, if you Review the WES required documents. That way you can see what is required from university and how your university should send those documents directly. We are used to working with students at the Office of Admissions. So if there's anything that you need as far as questions about this, please reach out to us so we can get you connected to the right resources and websites to get you started on that process. But looking at the admissions information, our applications are reviewed on a rolling basis. Our application is currently open for the fall of 2021 start. We review on an ongoing rolling basis, meaning that you do not have to wait until the deadline's posted on the slide to hear back from the admissions committee with your decision. We encourage students to apply early so you can receive your decision early. Our application deadline is July 1st, 2021, and we are here to assist students throughout your whole application. So if you have any questions or concerns on the application, you have a support system with us. We only enroll one time per year, so it is important to know that if you're excited about this program, we only have one start a year and each year. So our applications are now open for fall of 2021. And if you're interested in starting in the fall, but not sure you want to commit to a full course load, you do have the flexibility of starting one class at a time. To provide insight on the investment of school, right here is listed all of our financial information, as well as some information about our financial aid office. For those who are eligible to utilize other financial resources such as FAFSA or private loan information, you can feel free to look at our website or email, or you can even call them. The information is listed here. For the 2020-2021 school year, the tuition is $1,197 per credit. We offer an OPAL scholarship that is available for this program, which is a specific partial scholarship that covers $460 per credit, which leaves students responsible for the remaining $737 per credit. This scholarship is specific funding to our OPAL programs, which is for our online programs for applied learning. If you are admitted into the program, you are automatically awarded the OPAL scholarship. There is nothing additional that you would need to do to receive it. So if you are planning financially, you would want to plan for the $737 per credit at the current tuition rate. Of course, keeping in mind our tuition rate and scholarships are reassessed each spring, and any changes will be updated on the website in the late spring. So just to go over the credit breakdown, our certificate in global health practice is 25 credits at $737 per credit. Okay, now we have some time for our Q&A session. We do already have some questions that have come in already. So if you have any questions, please type them into the Q&A box so we can get them answered. I do have a question. I'll direct this to you, Dr. Brieger. Can you have an MD but did not complete residency and you decide to complete this certificate? Would this credential help in moving towards the international public health path?
That's a good, it's sort of a career question, because whether if you have the MD degree, of course, you'd be qualified to do the certificate. We actually have people do the certificate who have more than the minimum required bachelor's degree. Some have done a master's, some have even done a doctorate degree, but they have not done anything in international or global health, and so that's why they're looking for the career choice. Definitely, if it depends on what you're working for. If you are continuing to work as a medical doctor in a medical field, there would certainly be those requirements for that field, for the qualifications you'd have for that. So our certificate wouldn't replace anything that is required in the medical field. But if you're going into international health, you would, the certificate would help with that if you're not looking for certification to function as a doctor.
Hey, thank you. Since we're on the work experience, does the work experience have to be health related?
It should be relatively, what we call health related could be development. It could be in the area of education. It could be in the area of agriculture. It could be in the in those kinds of programs, nutrition, work against hunger. So the idea is that health, according to the Alma Ata Declaration, is very broadly defined in terms of could be in social work. So this is the kind of issue that we have. So, but it should be in some type of social or development service.
Thank you. I do have a question here. Can we speak to the difference between this certificate and an MPH?
Well, an MPH is a full degree. It's let's see, you have to get 80 credits for that, at least at our school. But basically, it's a year-long full-time program. Although we have a part-time MPH, you can do in 4 years, the same number of credits. You have to do a capstone and a practicum, and so it's an NPH is recognized as the actual professional public health degree. So what we're saying is that even we've had people with MPH apply to this because the school they went to did not have courses in international health, and they want to branch into that. So it's complementary, but it's not the same.
Thank you. How is online different than in-person learning, would you say?
Well, I think you all, because of the COVID situation, all of you have experienced the difference between working at home and working in your office. So a lot of that is the same. What online does is give more flexibility. It allows you to listen to lectures when you're available. You can listen to 3 or 4 lectures at once. You can take a couple days break. The actual face-to-face interaction is not there, but we, like I said, have discussion forums and live talks and things where we do have interaction among ourselves. You do have to be more disciplined, I think, to do an online course because, since it's flexible, you can let things go and then all at once realize it's near the end of the term and you haven't kept up. So you do have to structure your time well to be able to take an online course, because it's not like that every Monday, Wednesday, Friday at 9 o'clock you have to show up in room 327. You have you have to create that structure for yourself. But otherwise, the flexibility, I think, is quite valuable for working people. And we assume that most of the people who are applying have a full-time day job and even full-time family responsibilities and other kinds of social and community responsibilities. So that kind of flexibility is important for people who are in the workforce.
Perfect. Since we're on the experience of the online program, are the readings internet-based, or are there textbooks that need to be purchased for the program?
I can only speak for my own courses. Anything that I would like people to read, I provide a web link so that they can access it. I'm not recalling any of our courses where you have to buy a textbook. Of course, even these days, a lot of the books are ebooks, but I don't recall that. I think most of the resources you need to refer to can be accessed online.
Perfect. How much of time commitment would a student need to dedicate to the program, would you say, on estimate?
Well, it's the same type of estimate. If you remember from your undergraduate, they say if you take a 3-credit course, which is 3 hours of lecture, you probably would need to spend double or triple that in terms of doing homework, reviewing, reading, etc. So if you do that for one course, you can imagine that you do the same thing for other courses.
Perfect. Is there an application fee for the certificate?
SOFIS does charge something. And if you apply in SOFIS, you can apply to more than one program in different universities. I'm not familiar what the SOFIS fee structure is. Maybe you all know.
Yeah, it's $50 for the application in Sophos Express. That's for one application. I'm not sure about more than that. As far as what I see here, it says, do you provide guidance for career paths on post-completion of the certificate?
Well, we discuss that on an individual basis with students. We also, as I said, have a career office that you can contact for the School of Public Health. So definitely. But ideally, again, if you should be thinking about that in advance and indicate why you want to get this certificate in your personal statement. And are you thinking about strengthening your current career trajectory? Are you thinking about branching into international or global health where you have been working more domestically? So it's important for you to think about that now and include that in your personal statement so we can see why you want to apply to our program.
Thank you. I have a student asking about pursuing the certificate would make us a non-degree seeking student. Does this mean we cannot qualify for aid through FAFSA?
I think that's the case. Yeah, I think you have to be be in a full-time, be in a degree program. But I'm not sure.
So yeah, I would definitely contact the financial aid office information that's on our website, and they'd be able to clarify a little bit more on that end in regards to that. But from my understanding, I think there should be, as long as you're at 6 credit hours per term, that's something that could be a possibility.
Yeah, I was discussing that with Christina, our own administrator, yesterday or the day before, and if we make any modifications in the certificate program, because the state of Maryland requires less credits than we have at present, and we might be able to reduce that, which would reduce some costs. Again, that we won't know until a couple months from now. But, I was asking, well, in the past, we've made 6 credits available per term for people who want financial aid. And I recall her saying that financial aid is only for degree students. So there are people, of course, who are getting support from their employer for doing their certificate program. So looking at other sources of support would be important too. But if we do reduce the number of credits, of course, to bring it more in line with the state of Maryland minimum requirements, that might save some money too. But that's not a decision we've made completely yet.
Correct. I have a question on someone, they work currently for the Cancer Center, but also have completed a few volunteer summers abroad in local hospitals. They know that the 2-year experience it must be 2 years of experience with low to middle income facilities or locations. Is that preferable, or advising on, I guess they're asking what would you advise in that case if they should apply?
Well, again, even if you're at a cancer center, you see all kinds of people from all walks of life. So, again, that the cancer center experience would be relevant work experience that we would count toward the 2-year requirement. Additional volunteer work is always encouraging, and we look at that, and so that's important too. Sometimes people are out of school only 1 year, but they talk about the fact that they've been doing volunteer work while they were a junior or a senior in college. That's sort of hard to count because we definitely talk about 2 years post graduation, post baccalaureate. But having done that, some people, again, because of other reasons, may have done primarily volunteer work and not had a full-time paying job. But the volunteer work is equivalent to the time in the job. So, there, if you, of course, have questions, we do have counselors who are helping people in the admissions process, and you can obviously send me an email if you have a question about your CV and what you've done. But volunteer experience, with community groups of some kind is always something that we value when we look at the application.
Thank you. If they have not worked, post graduation, but they have additional credentialing, how does it have to be specifically post baccalaureate?
Yeah, we've run into that on occasion. We definitely want people to have professional health experience, and I have occasionally seen one or two over the years applications from people who have been a registered nurse and qualified for that, worked for 2, 3, 4 years, and then they got their BSN. And so sometimes in that particular case, because of the work experience, we might consider it. Basically, the goal of the program is to strengthen early and mid-career people. So if you have just graduated and don't have a career yet, we're not able to strengthen that. So, again, on a case-by-case basis, we can try to address this. Either the counselors that help you review your application, or an email to me, or you can ask them to contact me. That might be the easiest thing. Because it's always good to clarify that before you spend the $50 and go into sofas.
Definitely. I think you might have covered this. How much time weekly would they need for the program?
Well, again, if you take one 3-credit course, you would need 3 hours plus 9, at least 12 hours of time to study, read, do assignments, listen to lectures, etc. And so just multiply that by, if you're taking 2 courses, then that would be doubled. And again, the idea of the flexibility is that you can do this reading and assignments, whenever you're free.
Perfect. I have a question here. Does the certificate carry much weight that qualifies you for international global health appointments all over the world?
I would think so, yes, because especially since it's from Johns Hopkins, and especially since you would have already established some sort of a minimum career in a health-related field. So it would be, again, the art of developing a CV, the art of marketing yourself for jobs is a very important skill to have. So it's not the degree per se, or the certificate per se, or but how you, convince people that you have the experience, or the training, or the background, or the interest to meet, the kind of jobs that they're offering. So I think, again, this kind of how do you market yourself is a important skill, regardless of whatever program you're in.
Perfect. I do have a question about if they're interested in applying to a master's program. Is the application process the same?
Yeah, everybody goes through SOFIS. The master's programs, there are 4 of those currently in Opal. There are, of course, the masters like MPH and other kinds of masters at the school. You'll have to read the specific requirements for each, but the same issue is required for the number of years experience generally. You would also probably, if you're applying for a master's degree, would need a graduate GRE. The OPAL doesn't require GRE, but the other master's programs in the schools require graduate record exam. For the certificate, we require a minimum of 1 letter of reference. You can obviously have more to boost your case, but at least 1, whereas most of the other master's degrees require at least 3. So there are program differences that you want to look at online.
Correct. Yeah. Not specifically the master's program with SOFIS, and then the certificate program is SOFIS Express. So I'm not sure about specifically MPH, but they were referring to the question MPH as far as applying to that. So SOFIS is for masters and SOFIS Express is for certificate applications, if that clarifies that question a little bit more. And then I do have a question about, we did time commitment, the structure of the terms. There are 4 terms. How long are they?
8 weeks. And time flies.
They do. And then resources on assignments. How can students gain support through their classes? Are there TAs, faculty contact?
Oh yeah, because well, to tell you the truth, I get emails 24/7 myself from people. But we do have a minimum of 1 teaching assistant per course. Some of the larger courses have more than 1. But yeah, so there's always somebody to contact. And then, and that's for the academic side. We also have counselors for other kinds of issues and concerns and problems people have available to call on. So there's always somebody.
Okay, I do have a question. Can you continue on into a master's after completing the certificate if you find that you need it?
It depends very much. Most schools have a challenge in the sense that if you go to another school, they may require you to take their own courses. So again, we're gearing the certificate for professional development, continuing education. We're not, in other words, to strengthen the base that you have, or to, but the idea of some certificates that can lead in, then be a beginning for a master's degree. This is not the intention of this one. And I know, for example, that if you are applying for a master's degree at Johns Hopkins, for example, the courses in the OPAL tracks are not transferable. So they're because of the price differences, because of other things, the OPAL programs are separate and parallel to the other master's programs at Johns Hopkins. And again, what will be transferable from OPAL programs at Hopkins to another school depends very much on that school and whether. But for example, if somebody is enrolled in a master's program at Hopkins and they say, "Oh, I've taken a course just like that elsewhere," usually the instructor will then ask you to take an exam to show that you have those competencies. So, again, like I said, we did not design the certificate as a stepping stone, but as professional development, continuing education. Let me just say, I see somebody saying that he has a BSN. Yeah, that's obviously a degree. So that there's no problem there. And I mentioned again that some people may have gotten their experience as an RN before they joined the BSN program, and we'll be glad to look at the CV to see if that's the case in terms of experience. But otherwise, there's no reason why people with any kind of degree, but especially a health-related degree is nice. Yeah.
Yeah, of course. Could you speak to some of the key qualities that you're looking for in considering a candidate?
Well, one thing that we definitely look for is, can the person express why they want to do this program in their personal statement? That sounds, pretty obvious,
Yeah.
but I've been on doing reviews for OPAL, applications for the past 3 years, and I've been doing reviews for the MPH program for the past 10 years. And one of the things that never ceases to amaze me is the fact that people say, I'm applying because Hopkins is a wonderful school, and they tell us no reason why they are appropriate for Hopkins, why they are appropriate for the program, why they want to take that program, how that program fits into their career goals. So that, I would say, it's very important to convey. The other thing that's very important to do is to discuss with the person who's writing your recommendation letter, so that they too can say, based on what they know about you, seeing your performance, if it's a supervisor at work, or your academic performance, if it's somebody from your undergraduate, if that wasn't too long ago. It's very important for the referee to be able to articulate why you are a good candidate for our program. Not that you're a nice person and communicates well. Okay, that's fine. But does the referee think that you're relevant to our program? So of course that, and then we're looking for a strong transcript. A minimum of a 3.0 helps. We've had other considerations before, below that, but to maintain your status as a student at Hopkins, you have to maintain a 2.75. So if somebody submits a transcript and the GPA is 2.2 or 2.3, it doesn't bode very well for them coping with the courses at Hopkins. So we do look for, that kind of B average to help. The other thing, like we said, is the nature of the work experience and volunteer experience. Not the volunteer substitutes for work, but both together help us get a good picture of what the person is bringing to the course and where they might want to take it afterwards. So these are some of the things that we've considered in the past.
Perfect. And one last question, since it's almost one, I think it's a good question. Does the completion of the certificate give you an academic transcript from Johns Hopkins with academic credit hours?
Oh,
Or
yes.
hours?
Oh, yeah. Yeah, I'm always reviewing those, as technically I serve as the advisor to the students who are enrolled in our global health programs. And so when I go into our system, our grading system for the whole university, I see everybody's transcript. And so, yes, that is definitely done.
Perfect. Well, thank you all for your attendance. If we didn't get to your questions, we will be connecting with you offline. Our team at the admissions office will contact you directly in the next few days to assist in answering your questions. If you want to connect with someone immediately, my contact information is on the slide here. Feel free to reach out via email or directly calling me. If you are excited about this presentation and see this as part of your future, please feel free to use the scan code here to move forward with your application. And we hope to see you ready to move forward and apply. We have a dedicated admissions team who is looking forward to working with each and every one of you throughout that application process. Thank you, Dr. Brieger.
Oh, you're welcome. Thanks everyone for joining us.
Thank you. Have a great rest of your day. Bye-bye.